Welcome to Prisma Health Hillcrest Hospital. We are located in the upstate of South Carolina, the state's fastest growing area, just minutes from downtown Greenville. We've been serving our neighbors in the Golden Strip area of southern Greenville County since 1963. Hillcrest Hospital is a 43-bed facility with private rooms and 6 inpatient ICU beds. We are certified as a primary stroke center and accredited as a bariatric center of excellence for bariatric surgery. Prisma Health Hillcrest Hospital is also designated by the American Nurses Credentialing Center as a Pathway to Excellence organization. Focusing on short stay and outpatient surgery, our hospital delivers compassionate, high-quality, safe care. We offer 24-hour emergency care, laboratory services, a full complement of imaging services, physical and respiratory therapy, and diagnostic services. Next door to the hospital, the Hillcrest Medical Office Building offers orthopedic, pulmonology, and cardiology services. We provide local access to expert care. Hillcrest Hospital is part of Prisma Health, South Carolina's largest private nonprofit healthcare system and second largest private company. 45% of South Carolina's population lives within 15 miles of a Prisma Health facility. We are here to create a better state of health for South Carolinians. That's why our team members are dedicated to living our purpose. Inspire health. Serve with compassion. Be the difference.
Nurses and administration has a great relationship. They have an open door policy. The physicians treat nurses with respect.
Be it the person who works in the kitchen or cafeteria, be it the person who does EVS. It's a place where you can communicate with folks. You can always talk to them as they walk through the hallways. And I think that sort of stuff makes for a good environment to come to work.
You're more like a family, more like working with friends. You're friends with the doctors because it's so small. You really get to know them by their first name.
New nurses, there is definitely a culture of kind of taking somebody under their wing.
Hillcrest Hospital has watched me become a baby nurse to a wife to a mother, and now I guess I can call myself a seasoned nurse.
So as we increase our acuity level, we need higher level nurses. So it's not just a typical med-surg floor that nursing would be coming here to care for patients. The fact that we are creating that intermediate ICU level on the floor, along with our ICU and increased levels, I think nurses would be very satisfied and work at the top of their license.
Simpsonville is my home. I've been here my whole life, so it's really cool to be in the community and to be a nurse here at Hillcrest Hospital, and I think people who come here love it.
I think it's a great place, really. The schools are wonderful. All my kids have gone to some combination of public school and private school, so you have your pick, and I think they're all high quality.
Oh, and that's a big plus too. It's only 15 minutes away from downtown Greenville, which is beautiful place.
Living in the upstate for the last 10 years or so has really been a pleasure and fun to see. So we've just grown in leaps and bounds. Greenville and the surrounding areas, Simpsonville specifically here, close to Hillcrest, has just grown.
We are forward-looking. We're always trying to figure out ways to make not only the nurses' lives better, the physicians' lives better, but we're really trying to say, how can we enhance patient care? How can we grow? If you want that type of environment, I think this is the place to be, really.
We just recently received our Pathways to Excellence designation, which is huge for nursing. That was really hard to get for us because we applied right when COVID hit. So we have worked so hard, and our nurses pulled together and our administration pulled together, and we did it.
The thing that I am the most proud of is the zero harm that we've been able to maintain through an incredibly challenging time.
Whenever we only have 2 or 3 patients in the ICU, one of us will float to the ER or float to med surg, and we don't mind doing that.
Every day that I come into work, It is, how can I do the best that I can? How can I make myself as efficient as possible? How can I make my coworkers and I have the best day possible? And how can I deliver the best care to my patients so that I can leave at the end of the day feeling that I have given it 100%?
If you're interested in transforming healthcare, grow your career with us. Learn more about the opportunities available at Hillcrest Hospital by visiting prismahealth.org/careers.